The manufacturers of Hizentra are now packaging their subcutaneous Hizentra immunoglobulin in prefilled syringes. They are no longer packaging their product in a vial. Everything will remain the same. You will continue to use the Freedom 60 pump, the 50 ml BD syringe. Antiseptic wipes will be unchanged, as well as your precision tubing that will control your rate of infusion, as well as your needle sets that will go into to access your subcutaneous tissue. The only difference is how the Hizentra is packaged. The medication is the same, and how you will remove the Hizentra from the syringe and get it into the syringe that is compatible for infusion and administration of the Freedom 60 pump. The Hizentra syringes do not fit into the Freedom 60 pump. Only the 50 ml BD syringe will administer your subcutaneous Hizentra correctly. So instead of using the vented spike transfer device, you will now use a syringe-to-syringe transfer device. The syringe-to-syringe transfer devices have caps on both ends, so that will help prevent contamination of the tips. You will attach this to your syringe for your Freedom 60 pump. Previously, you had one vented spike transfer device for each vial. Now you will have one syringe transfer device for each syringe you need for your administration. If your dose is 50 mLs or more, you will need more than one syringe and more than one syringe-to-syringe transfer device. If your dose is 50 mLs or less, you will only need one. You will remove the caps to attach the syringes together. You will push on the full syringe to fill the empty syringe. When the syringe is completely empty, sometimes you will meet resistance. Sometimes you just need to pull back to get started, and then you can administer that into the syringe. And then you'll just repeat that with each syringe until you have transferred all your Hizentra into the BD syringes. Now this last syringe will not fit in with the rest of the dose, so I'm going to leave everything attached so I do not contaminate the tips of that syringe. I'm going to remove the second syringe. I'm going to remove the cap cover, and I'm going to be careful not to contaminate that. Remove that cap cover. Remove the last cap cover and connect the final Hizentra syringe. And then again, because the syringe is empty, sometimes I'll meet a little bit of resistance. I might need to pull back a little bit. Once I pull back and I don't have resistance, I should be easily able to fill that syringe. So now I will go on and I will attach my precision tubing and my needle set tubing and prime everything and administer my dose as I've always administered it, as I was instructed by my nurse. Should you have any questions, please contact Chartwell at 1-800-755-4704. We have our nurses and we have our pharmacy team 11 that can answer all of your questions.